everybody, and I hope you can hear me and see me. I don't get a feedback, so just assume it's all fine. A very, very warm welcome to our international virtual panel on Catalysing Change, a global health approach in the wake of pandemics. I'm so pleased that so many of you have joined us for this event. More than 160 registrations from 26 nations. That's truly remarkable. My name is Stefan Kaufmann, and I'm the founding director emeritus of the Max Planck Institute for Infection Biology in Berlin, and I have the honor and pleasure to serve as your moderator on this exciting panel of today. Our panel of outstanding experts in the field of global health will discuss the key components of a resilient global health approach and the strategies that can be employed to construct and maintain its resilience over long periods of time. Our roundtable takes on the conference brief, Global Health Approach for Infectious Diseases, a proposal for the next decade. This in turn then resulted in a workshop which took place almost exactly a year ago in Berlin, Germany, where experts discussed the different aspects of the future of infectious diseases beyond COVID-19. Our workshop was organized by the Leopoldina, the National Academy of Sciences in Germany, ESSA, the Academy of Science of South Africa, EAS, the Ethiopian Academy of Sciences, and ANSTS, and I say it in English, the National Academy of Sciences and Technology of Senegal. I don't need to tell you the enormous impact of the COVID-19 pandemic on our health system across the globe. I don't have to tell you that we witnessed great success stories, but also severe pitfalls. In some, we had to realize that we need to develop a more equitable and unified strategy for global health, which includes all countries on this globe, from the north to the south, and also from the east to the west. And this strategy needs to be sustainable and resilient. It is exactly these issues that we will expand on today in our round table. Before I introduce the experts, let me give you a few housekeeping notes. First of all, the topic is so broad, so important and so relevant that I would say a total of 60 minutes for the whole event is far too short. So my major task will be to take care that everybody stays in time, and I can kindly ask all speakers and discussants to help me in this matter as much as possible. So really my kind request to everybody, be brief and concise. Now this is the menu of today. Our panelists will be asked 1 or 2 questions each, for which they have a maximum of 5, better 4 minutes for elucidating on these topics. And then we will have a first round of Q&A for about 10 minutes, which will allow us to expand on the statements and clarify open issues. And then we have the eagerly awaited Q&A from the audience. During the whole session, you can type in your questions and comments via the Zoom function, and colleagues from ASAF and Leopoldina staff will select, bundle, and forward them to me as a moderator. I will then read them to the panelists. And that will then come to the end of our wonderful, I hope, and I'm convinced, meeting of today. Actually, I may have a note that I am very grateful to the panelists that they accepted to answer remaining questions in written form, so stay tuned after the session. I really hope, no, I'm convinced that this structure will provide the opportunity for all of you to engage with the panel, and that you feel encouraged that the networking of today will inspire us to pursue towards an impactful outcome. Now let's start with the panel, and our first speaker will be Professor Karisha Abdul Karim, Associated Scientific Director of the Center for the AIDS Program of Research in South Africa, in short, CAPRISA. Karisha has also been co-chair together with me and our colleagues from Ethiopia and Senegal in the series of workshops over the years on health issues, which took place in Durban or Berlin in alternating form. I have to be short and can't reflect on all her activities and honors. Apologies, Carisha, since that would just take too long. But let me just say, and that is true for all the speakers, there are short biographies attached to the program for further detail. Carisha, the floor is yours.
Thank you very much, Professor Kaufman, for that very warm introduction, and also setting the scene in terms of the history of this partnership between Leopoldina and ASAP. And when I think back about our first conversations about a decade ago, not much attention was being paid to infectious diseases. And it was almost prescient in terms of how this partnership was set up, because almost every year since then, we've had a major challenge and different challenges, highlighting this new era we've entered into of many epidemics and pandemics. And I've also been particularly excited about how we've been growing this partnership between science academies beyond ASAP and Leopoldina, bringing in, for example, the Science Academy of Uganda, Senegal, and Ethiopia. And I think it speaks to one important and common theme as we think about global security and we think about our interconnectedness and shared vulnerability, which is the importance of partnerships and collaborations. And I think these partnerships and collaborations have to be built on trust, and I'll expand on that a little bit more in a few minutes, as well as the synergy that's possible when we bring our different strengths together. But importantly, as we deal with increasingly complex challenges, we need more than synergy. We need to rethink how we approach complex challenges and elevate the level at which we approach and try to unravel solutions. This report that comes out of our first face-to-face meeting, and I hate to use the word post-COVID because we're not post yet. We continue to see more variants emerging and the challenges. But I think where we've entered is how do we live positively with the virus? And I think that's an important change and positive step that really emanates from the scientific contributions that have been made and the importance of science through vaccines, through medication, through other interventions that have enabled us to reach this point of living positively with the virus. But it also highlighted another important point, which is as we think about preparedness, and the focus of this particular seminar is the importance of dialogue and the importance of discussion and deliberations. And as we demystify the scientific method in terms of how do we get to points where we can act even though our knowledge may be imperfect. A key part, I think, is this recognition that when we're dealing with epidemics and pandemics, we are dealing with more than a pathogen. And I think we all still are continuing to reel from the social, economic, and political impacts and disruptions that are still leaving an imprint on our lives. And if we are to be better prepared, we need all sectors of society to be working together. And so part of the partnerships and collaborations are flagged is really at the scientific level, but we also need to strengthen that with industry as well as with the general public. And importantly, we need to work very closely with government to move towards more evidence-based decision-making. One of the key areas that we've identified in preparedness is around data. And data and good quality data in terms of surveillance is really critical in terms of us moving and ensuring that we mitigate outbreaks and outbreaks becoming epidemics and pandemics. And we can do that with pathogens that we know and have previously experienced. But when we have a new pathogen, we're really starting from ground zero. But these investments, as we've learned in what we know in HIV and TB as examples, Ebola, enabled us to pivot much more rapidly in our response to COVID. But data, being central and important, and particularly surveillance data, requires completeness. And this requires trust and us sharing the data that we have. But also we need to continue to invest in science. We need to continue investing in building the critical mass across the globe to be able to respond to epidemics, the skills that we need, and also the infrastructure to undertake the type of investigations we need to. But importantly, as we develop products, we've also learned a hard lesson from COVID about the issue of equitable access. And when faced with an existential crisis, that is not the time to be thinking about commercialization and profits, but that we do need to be looking at science as a public good, and science as a public good that benefits everybody equally across the globe. And part of this trust in science is eroded. And when we have the inequitable access and we see differences between ourselves, even though we contribute equally to knowledge generation, we see an erosion of trust in science. And as we think about populations that are impacted, we also appreciate and understand better that we can't, if we only focus on the product and bring the public in on board when we have products, then we can't expect the public to be adopting this instantly and in large numbers. In HIV, we learned an important lesson of global solidarity, but an important principle also that when we work to benefit the population, we have to do it with communities and not just on communities and hope for adoption.
Yeah.
It's also, just to wrap up, to flag two other points, is that COVID also taught us that we're dealing with multiple pandemics. And when we shift our gaze to the new pandemic or epidemic or threat, then we actually allow and enable the virus to thrive, and as we saw with variants of concern. So as we face new challenges, we cannot forget about other epidemics and pandemics, and we do need to pay attention to that. And let me stop there, and I'm happy to take further questions. Hope that sets the scene for the interventions to come along these themes. Thank you.
Thank you. Thank you, Karisha. Very precise and very clear. We will go on now with the statements of all the panelists and come back to possible question answers then later. So let me move to Professor Johanna Hanefeld. She's acting vice president of the Robert Koch Institute, the kind of German CDC, and also professor for global health policy at the London School of Hygiene and Tropical Medicine. I would like you to focus actually on the role of zoonotic diseases, which are often the source of outbreaks and then sometimes pandemics. So how can science institutes collaborate effectively with local communities, governments, with international organizations to enhance surveillance and early detection of zoonotic diseases so that we can prevent a spillover at the source? Johanna.
Yeah, thank you, Stefan, for the warm welcome, and thank you for the invitation to speak here among such esteemed colleagues. Just initially to congratulate the Leopoldina and the Academy of Sciences on a joint approach in the wake of a global pandemic. This is exactly, I think, what science needs to do, to come together, to share, to set an agenda that we can then work on together. And I think that's already the sort of first key point that I want to focus on is the collaboration And also, if you speak about resilience, sort of the key that empowered communities and our collaboration as a scientific community with those empowered communities has to both create resilience from the bottom up, but also really to address the risks that we see emerging. So congratulations on the initiative. Focusing on communities, on collaboration, and on zoonotic spillover events is vital, as Stefan mentioned, and as you set out in the brief resulting from the Berlin meeting last year. It's also very close to my heart because it combines, in a way, the research agenda that I'm working on together with the day-to-day work that the Robert Koch Institute, responsible for surveillance, but also for the sort of development of new methods to understand and critically measure risk. Is important. So understanding risk for new outbreaks of infectious diseases is important, and risk of spillover is really one of the key areas here, and for preparing and preventing such events from happening then. So using that science in a very important, in a very immediate way. So understanding this risk and understanding it systematically in a way that allows both forecasting and prevention is impossible without close collaboration. And that includes collaboration with the communities, but that also includes collaboration between scientists around the world, and in a very equitable manner. So we clearly need a better understanding of the drivers of the increasing and changing zoonotic risk that we have been seeing, and the speed in which we have been seeing this has been increasing over the past decade or so. This includes a better understanding, for example, of the social processes, such as urbanization and related mobility and migration, which changes both the context, but also the interaction between humans and animals. And equally, and perhaps even more importantly, given the times we're living in, is an understanding of how the changes in ecology that we're seeing as a result of climate change are changing the way in which humans and animals interact, including in agriculture and hunting, and where people live informally with animals. We know seasons are changing and landscapes are changing, and both have an effect on human and on animal health in their own right. And that's important, right? As any CDC around the world will tell you, well, we need to measure that and we need to take action on that. But at the same time, these changes also affect the interaction between human and animals. And this leads to the emergence of new risk, and we understand some of this much less, I think. And that's where it's vital that this brief also has shown a light on this. So one thing that we need here is obviously research, where we come together, and we come together globally to identify this research agenda and then to implement it. So research that stretches across the boundary of human and animal health, but also the ecology, to really find new ways to understand and then to estimate risk. So that's very important for somebody who needs to implement that and be able critically to prevent or indeed respond to outbreaks where they occur. So this is truly a One Health research agenda that you have articulated, and I'm very pleased to see that you have articulated it in this way, and happy to support this. But I think as a researcher, and I think that speaks to the point of collaboration, even more important, and this challenges all, is that we need to genuinely work across disciplines. So Carissa already mentioned this a bit in her introductory statement. We need the colleagues from microbiology and virology to identify the circulating pathogens and to understand the evolution, their changes, and where new ones emerge. But we equally need the colleagues from social sciences to understand the changes in human and animal health interaction. And we need ecologists to help us understand the changes in the environment. And that's perhaps the most vital point I want to make, my last point about this research agenda, has to come together at the community, right? So events happen at the community, varied as they may be around the world. We need to work together to understand risk, to then co-create the responses that will work in the respective settings. We need to listen and to learn. And while we need an understanding of this risk generically to some extent to be able to categorize it and forecast it and so on, but we also have to remain flexible and responsive to the different contexts. And that's why, for example, such an initiative such as this of the different academies of sciences is so really to be applauded, but also so vital. So much from my side for now. Thank you.
Thank you. Thank you so much, Johanna, for your insightful comments. Sure, we will come back to that topic on global One Health approaches later today, but it was very clear. So our next panelist is Professor Adrian Purin, Executive Director of the National Institute for Communicable Diseases, the NICD at Johannesburg, South Africa. Actually, Adrian, I have more or less two questions to you, and we now come to the more persistent, resilient kind of pandemics or endemics, whatever you want to prefer. Why should we consider international and national collaborations increasingly important for an enhanced preparedness, pandemic preparedness? And also then, what strategies have been most effective in mitigating the impact of the COVID-19 crisis on persistent diseases like tuberculosis and HIV/AIDS, which had been affected during the COVID-19 crisis? Adrian, stage is yours. Please unmute. Please unmute.
Something I've not learned.
Good.
Thank you very much for the opportunity. I really appreciate this. So yes, I think international and national collaborations are really key and central. I think they serve related functions and approaches, but I think that one can distinguish, I think, the international collaborations, for example, and Johannes outlined that in terms of the key areas around surveillance, I think is really critical, and those networks and collaborations are certainly key. And at the time, I guess, of the actual events, it also becomes really important to set the framework and the understanding. And that's where, for example, the WHO certainly guides, and having those conversations, the nuances that are really critical, and how to approach these globally, for example, the pandemics are really going to be really important. I think there are also opportunities, again, to establish technical assistance and technical direction. And those are, I think, what the international settings are really important, as well as the financial assistance as well. Because very often, I think many of the countries are really challenged quite severely in terms of how to actually institute the frameworks that are really required. I think if one then focuses on the national collaborations, I think those are, again, stemming from those international frameworks, is really, I think, the implementation of that becomes really critical. And I think that's where the difference is really implementing from the different levels, for example, the political advocacy level to the scientific, the social sciences that we've just been discussing. And again, a multi-sectoral approach will be really, again, really important to be established and approach it in a unified way. So really breaking the boundaries is really going to be really important. I think we've already stressed really critically a patient-centric or community-centric approach to this. I think that is really going to be key. And I think we've learned some hard lessons that we can certainly have the most beautiful approaches, but I think if we, as curation, and Jan has already stated, if we don't have the communities with us, it really becomes really challenging. I think the other areas that I think I would like to emphasize around collaborations, at least at a national level, again, is the establishment of, for example, appropriate networks around surveillance. That's really important. Again, in South Africa, where we have fragmented systems, trying to put those and drawing those together is really important. And I think we really learned a great deal about the collaboration between, for example, our private and public sectors to draw that data together and to be able to provide really key and important data in almost real time. It was really important. The other collaboration that I think is really critical for us is really around the laboratory surveillance systems, the technologies, which are really, again, critical around responsiveness, identifying cases to provide key epidemiological frameworks for us to respond to the epidemics. And again, building up from that really is to try and look at, for example, specific responses, for example, the development of vaccines or therapeutic approaches. So I think from my sense is that there are different approaches. These collaborations work in different ways, but they really are key to then to be drawn together to respond. With regard to your second question, in terms of TB and HIV, I think if you look at that data on the early stages of COVID-19, there was really a dramatic effect in terms of the extent of TB testing, for example, and the numbers of cases that we most likely have missed, and the excess mortality that we certainly observed around TB. just to an extent, we certainly saw that around HIV, but that certainly seemed to have recovered much better than, for example, TB, where in fact there was a drop in terms of identification of about at least 25% of the cases that we actually most likely have missed. So again, at least for South Africa, what we have is a TB response, a recovery plan to address this particular problem. In fact, we now have our plan 2.0. And again, there are different approaches that we've tried to adopt to this, and there's sort of 4 or so pillars around this, and that is to find those cases, to test those particular cases, to treat them, to retain them, and further prevention. And again, each particular strategy, for example, to find those cases is really centered around advocacy to make, again, the community aware of what we're trying to do. In fact, one of the assessments did show that even though we have these beautiful plans, not involving the community was a major error in terms of our particular approaches. So again, involving the community from the early stages, having the correct technologies and approaches, whether that be the molecular diagnostics to point of care testing, really becomes critical, and targeting particular communities or targeting particular populations, for example, those with HIV, the minors and so forth, really becomes important. Then treatment, again, having the appropriate approaches there, shortened treatment regimens becomes really important for this. And of course, retaining, again, looking at how to approach this is really becomes really critical. So thank you very much for the opportunity just to comment on some of these particular points.
Well, thank you so much for your precise and insightful ideas and comments on this very complex issue of emerging and current threats. Thank you. We'll come back to that, I'm sure, later. Our next speaker is Dr. Oliver Morgan. Hello. Oliver has been working for the World Health Organization since 2016, and he's currently director of the Pandemic Intelligence System at the WHO Hub for Pandemic and Epidemic Intelligence, based here in Berlin. So, Oliver, I would really like to ask you, what do we need to achieve a global open science, which was mentioned several times now, open science surveillance framework, and what is the biggest challenge? Oliver?
Great, thank you very much. It's really a pleasure to be here with you today. And let me start by saying I really love the framing of an open science framework for public health surveillance. I think that it captures really the essence of what many of us are working towards in public health. And the essence of open science is really to make knowledge openly available and to share that as widely as possible. And there are a lot of very exciting agendas, and I think the intersect between the open science agenda and the public health and pandemic preparedness agendas are really a very good place for us to be discussing. You know, traditionally, public health surveillance itself has been the domain predominantly of governmental entities in the historic sense. And there are quite a lot of structures that are out there which encourage sharing of knowledge from those governmental endeavors. At the global level, we have something called the International Health Regulations, which was the current version was implemented in 2005, but actually it's currently under discussion for review following the pandemic. But these international health regulations provide a more legalistic framework for how different countries can and should share information about public health events that are happening, which would have major public health implications, not only for their own country, but for neighboring countries and potentially for all countries around the world for pandemic risks. So that's a really important part. A fairly traditional part, one might say, but an important part of the kind of open surveillance framework that already exists. However, governments are clearly, not the only actors in this space, and there are many different actors really in the public health surveillance space. And excitingly, I think there are more and more non-governmental actors in this space, and I really welcome that. we saw many of those either stepping up or emerging actually during the COVID-19 pandemic, and they played a really valuable role in gathering, generating, and disseminating knowledge about what was happening. And of course, those actors are also already and have been working a long time in certain areas, such as HIV control. So the engagement with non-governmental actors, in particular non-governmental organizations, also academic institutions, is vitally important. And actually in the WHO Hub for Pandemic and Epidemic Intelligence, this is really at the core of why we exist, is to broaden out this engagement in public health surveillance. And part of open science is not just about making information more available, but actually being more inclusive in terms of the actors that are engaging in topics. That is a really important part of open science. And so that's an important part of the work that we do. We have a number of different initiatives focused on that. We're just actually now in our first year of implementation of an initiative called the Collaboratory, which is a laboratory for collaboration. This at the moment is focused largely around surveillance collaborations around infectious disease modeling, but again, really focused on trying to leverage global capacities and increase that knowledge exchange and interchange during acute events. We're also exploring other partnerships which are not traditional for international organizations like WHO, partnering with groups such as Global.Health, which itself is a global consortium of different academic institutions to look at ways that data and data flow can be optimized and improved. And that work is already ongoing. And we've also established something called an open source program office here in the WHO Hub. And the open source program office is really looking at how can we make our products more open. So software products, information products, maybe statistical products, and actually open source program office is an entity that's quite common in private sector entities. And I believe we're the first to try and implement a similar type approach within a UN entity as well. I think the last example I would touch on is our work in pathogen genomics. And this is an area where there's already a lot of exchange. There's a lot of openness in terms of sharing genomes about different pathogens that have been sequenced. But of course, this is a really good example where a lot more needs to be done, both in terms of engaging with different stakeholders in different parts of the world, making that technology available as well so that those stakeholders can participate in the open sharing that's already ongoing. Just to finish, there are a few areas where we still need to lean in and do some more, actually. And the first one that I was thinking about, and Johanna spoke to, was already around One Health. So open science involves inherently collaboration, and One Health is inherently a collaboration across sectors. So we still have a way to go. Johanna highlighted a few areas where we can do more, and we're looking at that quite closely and engaging as well. And the second area where I think we have a lot more to learn is around kind of citizen engagement in science. There are citizen scientists, there are many different groups. We heard about the importance of engaging with communities, super important in the public health surveillance and scientific endeavors as well. And within that, my last thought on this is really that we need to be particularly mindful that not all communities are digitally connected or have let's say, different levels of digital connection. And for public health surveillance, we really must think comprehensively about using technology, but also connect with all different types of communities as well. Thank you very much.
Well, thank you. Thank you. Thank you very much for this. And we will maybe come back, the time allows, on the impact of AI and interconnectivity over the globe. But now let's come to our last presenter of today. And that's a contribution from the private sector. And I'm pleased to welcome our last panel speaker of today, Professor Pedro Alonso. Pedro is probably known to many, if not all of you, from his time at the WHO. He's now Senior Vice President for Science and Medicine and head of the Global Health Office at BioNTech Germany, one of the companies that pushed forward in a very successful way, I would say, RNA vaccines against COVID-19. Can you, Pedro, tell us a little bit more how BioNTech's strategic initiatives can contribute to improve access to vaccines in low middle income countries? And what are the priorities of BioNTech? How would you like to define them? And could you perhaps a little bit allude on differences, similarities, complementarities between the WHO vaccine hub and the BioNTech approach? Pedro, now it's yours.
Thank you very much. Thank you very much. Pleased and honored to be able to join you here at this forum. Perhaps let me start by a couple of words about BioNTech, private sector, but very much a science-based organization. Perhaps some may not know that it fundamentally is an oncology company, and its work pre-COVID and still today is fundamentally using the mRNA platform to address different cancers. But it came to be known around the fast response to develop what effectively became the first licensed mRNA COVID vaccine to be used at the time or deployed at the time of the COVID pandemic. And the two co-founders, Ugur Sahin and Özlem Türeci, were already and became even more so aware of the inequities that the deployment of the vaccine implied. Also, the impact that some of the previous speakers have made of what COVID meant in other places, including Africa, fundamentally through health systems disruptions on mortality due to other diseases. And before, it's been alluded to the impact on TB and HIV. At the time I was at WHO, and I believe we were the first ones to actually model the potential impact of disruptions due to COVID on health systems and what could this mean for malaria mortality. And probably more people died of excess mortality due to malaria in Africa than to COVID itself. So the company was very aware of this. And so I will then make a few remarks on why is it that we do, what is it that we do, and how do we do it. So going back to the origins, COVID-19 expressed or manifested or highlighted the massive inequalities in health, which were there before and remain today. 25 to 30 years differential in life expectancy, depending whether you're born in some places in Africa, for example, versus if you're born in Europe or in the US. The key drivers of that differential in life expectancy relate to the causes of under 5 mortality, which is the big driver of life expectancy. And when you look at the causes in mortality in under 5s, infectious diseases remain the leading causes: diarrheal disease, respiratory disease, malaria, tuberculosis, HIV, and thus the global health inequities have still a massive unfinished agenda of infectious diseases. And when you look at infectious diseases, you realize that there is relatively little investment globally in that agenda, and certainly there's little investment in the development of new tools. That's why, and that's the big why, BioNTech, led by its co-founders, decided to develop an agenda, a portfolio of research and development of new mRNA-based vaccines addressing some of these large unmet public health needs. So what is it that we do? There's an ID portfolio. Some of this is already publicly known. We have new mRNA vaccine based on TB, malaria, HIV, and pox. We're also, I see, Stefan, that I should be coming to an end. Give me another 30 seconds.
Sure, yeah.
The ID portfolio, but we're also addressing the inequities through establishing an mRNA manufacturing facility in Rwanda, in Africa, that mirrors the mRNA manufacturing facility that BioNTech has in Germany, in Magdeburg. And a third pillar, which is capacity building. If we work in developing new products, if we do so in partnership with countries, we should also use this opportunity to strengthen human research capacity in our partner countries. Therefore, partnership is a key driver of how we do this and how we partner with countries, with multilateral organizations, with financing mechanisms, and other organizations. So sorry, it's gone slightly over, but that's why we do and what is it that we try to do. Thank you.
Thank you, Pedro. And we may come back to one or two issues. But anyway, now this is the first round has been completed as expected. I have to confess, slightly over time with all these important messages. This was kind of inevitable. So I would like now to, but I also see that the question answers is not really overcrowded yet. So we have a few minutes amongst the panelists now before we come to the question answer as planned. And I will throw in a couple of short questions in an attempt to expand a little bit on what has been said before and perhaps to specify this or another comment. So again, please be short and concise. I will, as I said, throw in a couple of questions, and I will also name the person that I would like to address, but that doesn't mean that that needs to happen. Everybody else could also argue on the issue, the brief issue, and also you can say, no, this question I don't want to touch, and leave it to others, and trying to get this a little bit lively. So I think one of the issues which I got from Johanna's presentation was how can one perceive increased societal collaborations that came up several times, because that, I think everybody on the panel agrees, is such a necessary component of a global health research project. So how can we perceive how do you perceive the increased societal collaborations? How much are they needed, and where are we currently?
Yeah, I think, okay, so I'm gonna try and answer, but please pitch in, everyone. So I think we need to go further, right? So I mean, the example I spoke about was zoonotic risk, and that's very clear that you have the researchers in the basic sciences and the natural sciences needing to work with the social sciences, and you have collaboration with agriculture, with animal health, but also the urban environments. And I think then if you move that from a research agenda to actually responding to something, or researchers working with responders, you do need to have different sectors collaborate. And I think the levels here are important. So I spoke quite a bit about community, but I think sometimes it's important to say at national level, some of this can be very difficult, right? So macroeconomic drivers are hugely important to some of those issues that I referred to. However, it can be more difficult to get ministries of finance, ministries of economics to the table. One thing, just to give us an example, is I find quite inspiring sometimes setting. So specific setting, you can either talk about community or cities, right? So there are quite innovative initiatives happening at city level, which highlight actually even in the sort of around tuberculosis, for example, sort of city approaches where you can get different sectors to collaborate, and they can then act as examples really to showcase, so how can a particular community or particular setting come together to do this better. I think we're at if you ask me where are we, just as a last point, I would say we're only at the beginning of where we need to be with this. So the more we can do there, the better. Thank you.
Yeah, thank you. If there are no further comments on that issue or question, I mean, obviously direct ones only, then I see Oliver Morgan raising his hand. You want to comment on this? And I think what you really should also perhaps include then would be how AI, modern state-of-the-art technologies, as the one Pedro and BioNTech brought up, how can that all be integrated?
Great, thanks. Yeah, I'll make a quick comment about the societal aspects and then make a comment also about kind of AI and technology. Yeah. So I think from a societal perspective, there are already many approaches of engaging communities and societies in public health surveillance, whether they're disease specific or geographically kind of specific examples, and that actually is becoming more and more popular in this kind of post-pandemic period. So that's quite encouraging to see. I think the extension of engaging communities in routine activities is that when you are in a more crisis setting and you wish to engage with communities for either kind of more detailed surveys, clinical trials, and so on and so forth, having better community engagement up front then facilitates that process, which is extremely important. So turning to some of the AI and new technologies, I think this is like in many parts of our personal lives, I think we see a mixed picture here. There are two domains of technology which are rapidly advancing, which have massively impacted public health surveillance and continue to impact public health surveillance. One of those is on the laboratory science side, where particularly molecular approaches to laboratory science are much more available now. And the other side is the data science component, being able to work with data in different ways. Artificial intelligence itself is a rather broad term. It includes a number of different methods and approaches. Today, when people talk about AI, they're often thinking about generative AI. I think there's still examples of experimental approaches using generative AI. I think we're still quite away from involving those in real policy decision making. But I think we need to explore that. But there are other AI approaches which are much more, let's say, mainstreamed around natural language processing and other types of AI tools that we're actually using a lot already and have been for quite a long time.
Okay, thank you. Further comments, or can I move on to one other aspect, which touches a little bit what Adrian and Pedro said? I mean, the kind of negative detrimental impact on point of care in TB, HIV. Adrian brought that up, and obviously Pedro, the malaria issue. So how can their state-of-the-art technology, digital solutions leverage to overcome these kind of, I would say, pitfalls of the last crisis caused by COVID-19? Adrian, would you start?
Yes, certainly. I think one of the approaches in terms of the national plan is really to try and involve communities by, for example, using technologies. And one way in which we could do this is, for example, they have an application called TB Check. So in other words, if that becomes available, individuals can certainly participate, and if they are identified and have the particular symptomatology, this is a way in which they can connect with the healthcare systems, as an example. The other way is the sort of bidirectional approaches. Again, that is to provide that data to the individual patient rather than trying to send it to a facility and then manage those particular processes, because we know that there's loss to follow, for example, people not returning for their results. And again, we've been trying to utilize these types of technologies in order to provide results to the individual patients, again, provide them with the opportunity not only to come back in terms of collections of medications, but for example, counseling, for example. So again, one can use these types of technologies to really connect with your patient at the end. And there's a different level, not only at that patient level, but also in terms of our fragmented systems again. We did find that the approach of using APIs to link, for example, private and public data really became an important use of that technology in order to generate the necessary reports. I think there are opportunities at different levels to utilize technology in terms of either patient care, counseling, but also I think in terms of trying to bring back, Qureshi spoke about quality data, and these are approaches that one can use to achieve that effect. Thank you.
Thank you. Thank you so much. Pedro, you want to perhaps comment on vaccines, malaria in that context, or
Very, very briefly.
totally independent? I mean, vaccines on the one hand and
Sure.
Yeah.
Very, very briefly. I mean, going back to the COVID-19 times, I mean, what at the time, and this is going back to March 2020, we were extremely worried as to what the impact could be of COVID-19 on health systems, disruption, and malaria. What we did at that point is actually request a number of modeling groups to estimate different scenarios of different levels of disruptions and what impact would that have on diagnosis, treatment, and deployment of preventive tools. The scenarios that we painted a number of scenarios. Some of them were quite horrific, taking us back 20 years in the fight against malaria and doubling malaria deaths. The key purpose of that was actually to help us mobilize the community, both internationally and nationally, to actually accelerate deployment of tools, which we did, and I think essentially managed to avert the worst possible consequences. Still, there was a 30% increase in malaria mortality and so on, but the worst consequences were averted through that mechanism. Underlying all of this, I think we just need to acknowledge that we have terrible data. Still today, our World Malaria Report, as well as any estimates that we use on burden of disease due to malaria, are actually modeled data, because surveillance systems in most moderately to highly endemic malaria countries are simply not good enough to paint a good picture. I think that there's a massive need for taking this surveillance as a key priority.
Yeah, thank you. Perhaps I think in coming to an end, Carisha, you want to add anything to this, or can I ask you directly also? How do you feel with our workshops over the past years and the papers that came out? You feel that the recommendations are going into reality, or is there a long way to go? How would you feel it? This is kind of more feeling. Nobody can predict the future, I know. Yeah.
Yeah, I was actually thinking about a general comment, Stefan, around the importance of science communication, given our emphasis on evidence-based approaches and better preparedness, resilience, etc., is that, we do a good job as scientists in terms of peer-reviewed publications, but not a great job in terms of communicating our science to the public. And I think we started to see some of that in COVID, and also now increasingly in HIV and TB, and that whole piece around knowledge, co-knowledge generation, I think is so important as we move to this era of a convergence and conjuncture of many complex challenges. And I think in the midst of all of this, we're seeing an emergence of precision medicine as articulated differently by different people, and this move towards more self-care. So if we're really going to have empowered and enabled communities, we do have the historical inequalities that need to be addressed, but also better adopt and adapt with the new innovations that are occurring and taking place, and all of that would help narrow the gaps. So just the final point around these infectious diseases symposia, I think have been incredible between the science academies. I particularly like these virtual panel series initiated by Leopoldina as part of that broader science communication, where we bring all sectors of society together, all disciplines together, etc. And I've been particularly struck and encouraged and inspired by how these partnerships between the science academies have grown in the decade, and how we're reaching a point where we can look at things like the pandemic treaty and have these conversations to look at how do we move from legislation and guidelines to actual implementation, and that resilience part of generating new knowledge. As we all know, we don't generate knowledge when we need it. We scientists anticipate it, and the more we anticipate that, and the more we can predict to the future, the more likely we are to have that resilience and better preparedness, particularly when facing new problems, and then not losing sight of the existing problems as new problems face us. Thank you, Stefan.
Thank you. Thank you for this kind of concluding remarks of that part. I now come to the question answers. There were only a few questions. Now they are coming up more. I have them both in the QA. I'll try to be short. The one question from Friedemann Trutzenberg. During the COVID-19 pandemic, we have seen that despite sufficient scientific knowledge suggesting an urgent need for international cooperation and equitable global access, I make it short now, this did not really work out. So scientific knowledge was there, but policymakers did not act accordingly. What is needed to prevent this to happen again during a next global emergency? So this is the kind of translating at the point of care policy making. Who wants to answer that question in a very brief answer? And one of you should raise hand now. Yeah. Well, I've got Oliver or Hannah. Yeah, Oliver. Brief, please. Brief.
Maybe we can both have a quick go.
Yes, right.
I think this is a critical step. I think this is extremely hard. I agree with the question. There was a lot of evidence, and we could have, which could have informed decisions. I think the decision-making process itself is extremely complex and balances a whole range of different factors. Certainly, when it gets to the national level. However, I do believe that the conversation that we're having about open science and about engaging in communities sets a better environment for policymakers to make better decisions as well.
Thank you, Johanna.
Yeah, maybe I can just complement what Oliver said.
Yes,
I think
please.
the uptake of evidence is not linear, right? And we've seen that, and we've seen how complex that is. And I think we have all understood that the evidence to policy pathway is something that we need to invest in during this time, be it around scientific advisory panels, be it around the type of evidence we provide and the way in which we provide it. And that is an aspect of science that is just as important as all the other things we've spoken about. And I think as a scientific community, we've understood it. My sense is that the policymaking community has also understood that the importance now is that we use this time not to forget the importance of it, but rather to put some of those instruments in place that we can have a better pathway there next time.
Thank you. I come to the second question, which is more or less on misinformation during COVID-19 pandemic and how it could contribute to vaccine hesitancy and other issues. I make it very short. And the question is from Taco Chanyi. And obviously, the question is then, how can we strengthen arguments and activities that counter any, and that's my personal words, kind of fake news? Hesitancy. Again, Johanna.
Yeah, apologies. I'll just start us off. So I think
you have to be short on that because that's a whole other subject.
Again,
yeah, it's important.
Yeah, what the pandemic has shown is risk communication and the communication around public health and social measures is as vital a part of public health as the pathogen characterization and the connection between lab and surveillance, right? So all these parts are important, and we need to massively invest in that. And I think any scientist listening to that, I think those are the fields of science that we need to build as part of a global health approach, just as much as the microbiology and the virology.
Yeah, and actually, as I said, this should be a topic of another hour because it isn't important, and clearly it also plays a role here. The last question which I see is actually again on zoonotic diseases, and more or less the question, shouldn't we look more on unusual hosts? I see a low level of surveillance, James Olopade, of potential viruses in unusual hosts. His group studies, his group studies zero prevalence in dogs in Nigeria. We need more of the reverse zoonotic potentials, and I think everybody agrees on that. And and if it is just a yes, you are totally right, then I can give the answer. But is there any further comment? No,
I would say, I mean, yes. I'm happy to make a comment, basically because we're now deeply involved in mpox and monkeypox. So
yes, sure.
Do we need improved surveillance in unusual hosts to identify new zoonotic spillovers? Big yes. Do we need improved surveillance in the humans to identify, which, for example, right now we are still having significant challenges on identifying the magnitude and direction of the mpox endemic and epidemic, two coexisting elements in, for example, DRC or Nigeria? Absolutely, yes. So one should not separate one from the other. Ultimately, we need to understand when new diseases appear in humans and be able to track them and address them.
At the earliest stage, yes. So we're coming to an end. Let me ask one very brief question to all of you, and only one sentence or a few words. We don't want sentences like 100 words, so please be brief and concise. What immediate action would you prioritize to ensure the sustainability of our global health approach? And let me start with Oliver. One sentence only.
I think investing in the next generation of scientists around the world, have a more equitable workforce is the most sustainable approach.
Adrian?
I'd like to see the investment in terms of our infrastructure around our surveillance. That's going to be really key for us in South Africa, or one of the keys.
Johanna?
I would say investing in national public health structures.
Parisha?
So seeing that everyone has said the things that I had up, I just add on manufacturing and production capabilities. We saw, so let me leave it at that.
Pedro, probably similar, but I leave it to you.
Yeah, sorry, I lost the connection for a couple of minutes. Further investment in research and development. Manufacturing, of course, is important, and that's the last component, but we need to have something to manufacture. And we often don't have a lot of things to manufacture. And we're often starting the house by the roof rather than setting the strong foundations which we need.
Thank you. A lot to do. We are slightly over time, so I will be very brief, but I think this is an important final point that I cannot leave out, namely a very, very warm thanks to all of you, the panelists for sharing their expert ideas, you all in the audience for your interest in this important topic that needs to be kept alive, even though the perception, in my personal opinion, of pandemic preparedness every now and then looks like it wanes a little bit in the political arena. That is has to be stopped if it occurred at all. And last not least, of course, let me thank the staff of Leopoldina and Asaf, who worked so hard behind the scenes to make this all such an exciting event. Isabel Scher and Thomas Plötze from Leopoldina, and Kutsufolana Melusi from Asaf. Let me end with a very short comment on an African saying, which you probably all know and which I like a lot. If you want to go fast, go alone. If you want to go far, go together. I think that's very insightful, but sometimes I wonder whether it's sufficient for a pandemic emergency, where events with enormous consequences can occur so rapidly within days or even hours. So perhaps by combining the efforts as they were described today, we can go both fast and far by harnessing the global and local perspectives, the different kinds of expertise from all over the globe, from north and south, east and west. With this outlook, let me thank you all for joining, and I wish you a wonderful day. Thank you. Bye-bye.
Thank you. Bye-bye.